Welcome to today's episode, where we'll dive deep into the world of ethics in mental health practice, specifically focusing on the American Psychological Association Code of Ethics. This episode serves as a companion to the course offered by Therapy Trainings, which provides 5 continuing education hours. If you're a mental health professional, counselor, or therapist, you'll want to stick around as we unpack the essential elements of the APA Code of Ethics, how they play out in real-world scenarios, and what you can do to enhance your ethical practice. Now, you might be wondering, why is the APA Code of Ethics so crucial in our field? Well, the simple answer is that ethics guide us. They shape our interactions with clients, inform our decision-making, and help protect the integrity of our profession. Today, we'll cover key points from the course, including the structure of the code, the application of ethical principles, common challenges we face, and strategies for maintaining ethical standards in our work. Let's start with the structure and content of the APA Code of Ethics itself. The code is divided into several sections, each addressing different aspects of ethical practice. At its core, the code emphasizes 4 primary principles: beneficence, nonmaleficence, fidelity, and justice. Beneficence refers to the responsibility to help clients, promoting their well-being and ensuring that our interventions are beneficial. Non-maleficence is the commitment to avoid causing harm. Fidelity involves being trustworthy and maintaining the integrity of the therapeutic relationship, while justice demands fairness and equality in our services. Together, these principles form the backbone of our ethical responsibilities and guide us in our daily practice. The APA Code doesn't just exist as a set of rules. It's a living document that reflects our evolving understanding of ethical practice as we interact with diverse populations and encounter new challenges. Speaking of challenges, let's transition to discussing some common ethical dilemmas we face in the field. Situations such as dual relationships, confidentiality breaches, and informed consent can be tricky. Imagine you're working with a client who also happens to be a neighbor. This dual relationship can blur boundaries and complicate your ethical obligations. The APA Code provides guidance on navigating these waters, highlighting the importance of maintaining professional boundaries and discussing potential conflicts with your client openly. Confidentiality is another area where ethical challenges often arise. As mental health professionals, we are bound to protect our clients' private information. However, there are exceptions, such as when there's a risk of harm to the client or others. In these instances, it can be difficult to balance our ethical obligation to maintain confidentiality with our duty to protect. The key here is to establish clear guidelines with clients about confidentiality and its limits right from the beginning, so they feel secure in sharing sensitive information with you. Now let's explore informed consent. This isn't just about having clients sign a piece of paper. It's about ensuring they truly understand what they're agreeing to. Informed consent means communicating clearly about the nature of therapy, potential risks, benefits, and the limits of confidentiality. This is particularly important in our diverse society, where cultural differences can impact how clients perceive consent. It's vital to consider these differences and adapt our approach accordingly. Speaking of diversity, the ethical responsibilities regarding cultural competence are paramount in our practice. As mental health professionals, we work with individuals from various backgrounds, each with unique perspectives and experiences. It's our responsibility to be culturally aware and sensitive, understanding how cultural factors influence clients' experiences and treatment. The APA Code emphasizes the need for cultural competence, urging us to continuously educate ourselves about different cultures and to seek supervision when we encounter situations outside our expertise. Let's take a moment to discuss the importance of professional competence, supervision, and training. The APA Code underscores that we must practice within our areas of competence and seek assistance when necessary. This is particularly relevant in today's rapidly changing landscape, where new therapeutic modalities and technologies are constantly emerging. Engaging in ongoing education, like the courses offered by Therapy Trainings, is vital to ensure that we remain competent and provide the best care for our clients. Navigating the disciplinary processes and consequences for ethical violations is another crucial component of our ethical practice. No one wants to think about facing a complaint, but it's essential to understand the potential ramifications of ethical breaches. The APA Code outlines the procedures for addressing violations, which can range from reprimands to loss of licensure. It's a sobering reminder that we must remain vigilant and committed to ethical practice, not just for our clients' sake, but for the integrity of our profession as well. Now let's touch on an increasingly relevant topic: ethical considerations in teletherapy and technology. With the rise of digital platforms for therapy, we face unique ethical challenges. For instance, ensuring confidentiality in an online environment can be complicated. It's essential to utilize secure platforms and educate clients about safeguarding their information during virtual sessions. Additionally, technology can create a sense of distance that may impact the therapeutic relationship. It's crucial to remain engaged and present during teletherapy sessions, just as we would in person. Remember, just because we're connecting through a screen doesn't mean we can let our ethical standards slip. You might also be wondering about leadership and advocacy in the context of ethics. As mental health professionals, we have a responsibility not just to our clients, but to our communities and the profession as a whole. This means advocating for ethical practices and policies that promote mental health and well-being. Whether it's participating in professional organizations or speaking out against stigma, our voices matter. Now that we've covered some key elements of the course, let's address a few common misconceptions about the APA Code of Ethics. One prevalent myth is that the code is merely a list of rules that we must follow. In reality, it's a nuanced framework designed to guide us in making ethical decisions. It's not about rigidly adhering to guidelines, but understanding the principles behind them and applying them thoughtfully in complex situations. Another misconception is that ethical issues are rare. In truth, ethical dilemmas can arise at any time in our practice. Being aware of this reality and preparing to navigate these challenges is crucial. This course offered by Therapy Trainings equips you with the knowledge and tools to address these dilemmas confidently. As we approach the end of our episode, I want to leave you with some thought-provoking insights. Ethics isn't a one-time lesson. It's an ongoing journey. The landscape of mental health is ever-changing, and so are the ethical challenges we face. Staying informed and engaged in discussions about ethics is essential for our growth as professionals. I encourage you to reflect on your own practice. How do you ensure that you're upholding ethical standards every day? What steps can you take to foster an ethical culture within your practice or organization? And remember, if you're looking to deepen your understanding of the APA Code of Ethics and enhance your ethical practice, be sure to check out the course offered by Therapy Trainings at therapytrainings.com. They provide valuable resources and training can make a significant difference in your practice. Thank you for joining me today as we explored the essential elements of the APA Code of Ethics. I hope you feel empowered to navigate the complexities of ethical practice in mental health and continue to advocate for the well-being of your clients and the integrity of our profession. Until next time, stay ethical, stay informed, and most importantly, stay compassionate.